Welcome to Micro Health Talks, where we bring you insightful discussions on all things that is health and wellness. Today, we would love to address a concern that spans all genders, all borders, and all ages. A concern which is faced by the people a million fold. A concern that is often considered as a statement of beauty, but a concern that can lead to frustration. Yes, hair and hair fall. To speak more on this, today we have a renowned dermatologist all the way from Iran, Dr. Azin, who is working in Quttainah Medical Center. Doctor, welcome. Welcome to Micro Health Talks. To start with, Doctor, why hair fall?
Well, hair fall has different reason.
Okay.
Usually, we have hair fall as because the hair has a cycle. That first is anagen, that the hair grows, and then hair rests, and then telogen that it falls.
Okay.
So also we have normal hair fall because when the hair go to the telogen falls, then the hair will fall and the new hair grows.
Okay.
But when this fall increase, we have the disorder, hair fall disorder.
Okay.
That this disorder has different reason and different causes. If you want, I can explain.
Please, Doctor. Please, Doctor. Doctor, along with that, can you please also explain us at what point we realize this hair fall is not usual, but this is a disorder?
Every day till 100 to 150 hair if fall, it is normal.
100 to 150 is normal.
Yes.
Okay.
But more than that, it has many different causes and it is abnormal.
Abnormal.
Yeah.
Okay.
We have different type of hair loss. One is telogen effluvium. When someone, for example, have stress or disease or surgery or diet and lose lots more weight in very short duration,
Okay.
they will causes the hair fall that's named telogen effluvium.
Okay.
The shock happen to the hair and all hair suddenly go to the telogen phase.
Okay.
And then they start to fall. For this cause, after some supplement and when the
Diet.
correct, it will discontinue and patient will be normal after this reason
Okay.
corrected.
Okay, Doctor.
Another type is androgenetic alopecia that can be in female or male pattern. This one have genetically based and the testosterone hormone may cause hair become thinner and then hair fall. And there are different hair loss that they are inflammatory hair loss, like lichen planus or alopecia areata, that they are autoimmune basis. By physical exams, look at the scalp skin, we can understand if it is inflammatory, it causes a scar like lichen plant, or no, it is not scarring alopecia.
Okay. So, Doctor, like one basic question that everybody has is like, all men are of that belief that hair fall is common in men than women. Is it true? Like, in what gender the hair fall is? Like, is it same or is it more in female and less in men?
No, because we have different type of genetic androgenetic alopecia. Also, female can have this hair loss, but the pattern is different. Sometimes it is female pattern that is diffuse hair loss in female, but in some female, they will have the same pattern as male.
Male as well,
Yes.
isn't it? Okay. So, Doctor, like, what do you think are the basic reasons?
Basically, the main reason is genetic.
Genetic.
Yes. And mostly in male pattern alopecia and in male patient, its genetic depend on, for example, their uncles. I mean, the brother of their mother.
Oh, from
Yes.
uncle. This is
Yes.
very new. Okay.
Yes. And I always ask, how is your uncle's hair? Because it is very strong genetic.
Okay.
Yeah.
So that is a direct relation for the hair.
Yes.
Okay. So, doctor, apart from that, many of us, like most of us female, these days male as well, they go for treatment, a different type of treatment. And we don't know this treatment are right or not. All that we know is there is a lot of chemical and this is artificial. And they assure us this is for good, this is something collagen, this has protein in it. So to what extent we can believe the hair treatments and what is a right treatment for hair?
No, different hair loss has different type of treatment.
Mhm.
For example, the one with androgenetic alopecia, we should focus on the hormone and suppress the effect of the male hormone that will make the hair thin and it will loss.
Okay.
So, for example, for the telogen effluvium, we can use some supplement, but the supplement that just is really work
Okay.
is collagen that is good for skin, nail, and hair.
Hair.
And some supplements like zinc or biotin may help a little for the telogen effluvium, not for the androgenetic alopecia.
Okay. So speaking about supplements, doctor, this was my last question, but I'm adding it in between. What are the best food that you suggest for good hair or hair growth?
No. If one's diet is regular, protein and carbohydrate, the normal that is in her in its range, it will help. But when someone have diet and lose a large amount of weight in very short period, they will appears the hair loss after a few months.
Few months. Okay. So then, doctor, there is yet another very huge concern that is faced by all people, irrespective of age. That is hair graying. Doctor, we thought the only reason for graying could be age, but it's not. We see hair graying in pupils and teens, and like kids who are in the 20s. So, doctor, what is the actual reason for graying other than genetic?
Some diseases like thyroid disease or alopecia areata may cause hair graying. For example, the thyroid disease may cause the hair gray in very soon age. Or in alopecia areata, when the hair wants to regrow, first they grow as white hair.
Okay.
And vitiligo, it's an autoimmune disease that damages the melanocyte, the pigmented cell. The white color.
Scars.
Even when they affect the hair, maybe the hair become white.
White, I see.
Yes.
Okay, doctor. Like these days, we see in advertisements brands promising us your white hair. Other than the dyes and coloring, there are certain treatments or oils which promise us your white hair, your gray hair can be turned black. The new hair growing will be black.
No.
Is it true?
No, it is just a
Okay. So scientifically, it is false.
Because there's a stem cell that's for the pigmentation of the hair. When the life of this finish, so nothing will.
There is no reverse in it.
Yes.
Okay.
But now there's new treatment, exosome. It is not approved yet by FDA.
Okay.
But in some articles, they say that maybe it helps the hair become black.
Okay, so doctor, apart from that, to what extent the geographical locations induce the hair fall or the health of the hair? Of course, according to the geography, the color of the hair changes. So, to what extent that induce the health of the hair as well?
You mean, for example, sun?
More rapid.
More exposure to very intense sun will cause hair damage, or very cold weather may affect the hair health. And also the type of the water. Yes, for example, here in Qatar, the water is not good, and people complain about it. That when they come here, they have hair loss.
We have experienced that. We are victims of that. But then it has reduced. Okay, so doctor, like at another concern, we come from the South Asian countries, and we have a lot of beliefs, or I don't know, it is myths or beliefs. So we have a lot of traditional practices for hair. Oil your hair daily, wash your hair daily, apply certain packs, which is some herbal leaves packs. So scientifically, how do you come into this?
For washing the hair, it depends on the type of the skin of the hair.
Mm-hmm.
The one with oily skin,
Mm-hmm.
they should wash daily.
Okay.
But the one that have very dry skin and not oily skin, they can wash, for example, one or twice a day.
Twice a day.
A week, sorry.
Oh, twice a week. Okay.
Yes.
Yes. So that is about hair wash. And how about oiling hair, doctor?
Oil, for example, argan oil or olive oil,
Mhm.
they help the damaged and dry hair to become better.
Better. Okay.
And some herbal things like rosemary
Mhm.
are good for hair loss.
Mhm.
And there are different brands that contain herbal oil, herbal ingredient for hair loss. Some of them work, but it's depend on the people.
Type.
Yes, in some people it's work, in
Mhm.
some not. And also, for example, for lichen plant that is inflammatory and scarring alopecia, none of these works.
Works. Okay. So, doctor, the one go-to remedy for hair fall is PRP treatment. So, how do you comment on this?
PRP is just a complementary treatment, like some vitamins, mesotherapy, or exosome, or hair filler. It depends on the hair loss causes. In some people, it's good, and it can be a complementary treatment beside the medicine. In some, it doesn't work. So, because most people come and ask for PRP, they should consult with the dermatologist, and if it is suitable for them, they can use it. Okay, so doctor, as a dermatologist, how do you confirm that okay, this person can go for PRP? What are the tests? Can you give some example of the test that you recommend, or you want people to, the people suffering from hair fall to undergo? For the test, they usually test, for example, thyroid, vitamin D, CBC, and iron 14, because anemia or low vitamin D or thyroid dysfunction may cause hair loss. So it's good to work up for these general things for hair loss, and it depends on the case. For example, for female, if they have some hormonal problem and any symptom of the hormonal problem, we should check the hormone lab test. Okay. Doctor, like along with PRP, what do you say about hair transplant? Is it advisable? Yes, what are the pros and cons? Hair transplant is the treatment for the people that have hair loss. From the back side, we can the donor part. If it is good donor and it has good amount of hair, we can take that hair and transplant. But this one also, if the people genetically have weak hair in the back, when we transplant the hair in the front, it will lose because genetic influence that hair. Right. But in the people that they have good back hair, the hair that we transplant will remain. But the other remaining hair in the front, because of the hormones influence, will become thin and will lose. Okay. So, beside the hair transplant, the medicine like finasteride should use to keep their hair. Okay, doctor, speaking about some tips that you have given, our viewers will be like so excited to know some health tips for hair, for good hair, for healthy hair, for hair growth. What tips would you recommend our viewers? One thing is that the salon said that protein therapy or Botox therapy like this, they will damage the hair because they are chemical ingredient that make the hair become breakable. Okay. And when people do this treatment. They are not treatment, but they said protein treatment.
Yes.
When they do these things, their hair become more breakable, and after 1 or 2 months, they will experience more hair loss. So it's good, for example, depend on the skin of their scalp. If it is oily, washing for daily is good for them. If some people have dry hair, they can use suitable conditioner or hair shampoo or different oils like argan oil. It depends on advice by their dermatologist.
So, doctor, like people who wouldn't have been gone for a consultation with the dermatologist, they'll be having this concern. Like, is it advisable to use shampoo or not? We have been heard from, some tips that sulfate-free shampoo is advisable, conditioners are advisable. What is the comment on that?
No, they are different brands, different advertising. It's better to consult with the dermatologist to choose the right one for them.
Isn't it? Doctor, like we have seen people like who don't have any hair care tips with good hair, black
Because
hair.
it is genetically.
Okay, so that
Genetic is the
credit
most
goes to
important.
the genetic. Okay, so we envy them.
Yeah.
So, doctor, what are your personal hair care tips?
Actually, my own.
Yes. And there's some traditional tips from Iran. Iran, the place which is known for the beauty. So please advise us something on that.
The one thing is doing lots of, for example, hair ironing or hair drying make the hair strand damage.
Okay.
Or if you combing your hair when it is wet in the bath, it damage your hair. If you have, for example, dry hair, it's better use argan oil or hair cream that make the hair more moisturized.
Okay, so these are your personal hair care tips.
Yeah.
Okay. So, doctor, apart from that, you advised about some food. You advised some treatments. Can you also advise some blood test?
Yeah.
By which you can actually make out the reason for hair fall?
Yes, besides the basic test I talked about, recently there are a new technique and new blood test or genetic test that exactly showed the result of the hair loss. And based on this result, we can choose the best treatment.
The right treatment, precisely.
Yes.
So that comes to a part of precision diagnostic and also then
Yes.
precision medicine.
It's very interesting.
Okay. So that comes under. Does it comes under the category of hair PGX or what category that comes under? It is.
You mean
So these kind of tests.
These kind of tests are kind of genetic tests.
Genetic test. Okay. So yeah. So you advise the viewers to go for that before.
It is better before trying different treatment by these new techniques. First, understand the result and choose the right treatment.
So go for the right root cause and then treat it. Yeah. Okay. So, doctor, is there anything else that you would love to share to our viewers who are anticipating, who are facing hair fall and who are anticipating some tips to stop it? One last tip.
The one and important thing is genetic.
Okay. So other than that, eat good, stay clean.
Yes, don't have stress.
Or stress affects us.
Yes.
Okay.
And don't be on a diet with too much weight loss because it will ruin the hair and also skin.
Yeah. So to conclude with that, as there's a lot of tips we have heard. It's all about we know hair is called the crown of the beauty. So without crown, how we flaunt ourselves. So to make sure that we don't lose our hair, please, going back to the tips, eat healthy, know what are the actual reasons for your hair fall, and then treat it. We would have been seeing a lot of advertisement and campaigns in and around suggesting that this do's and don'ts. But doctor is advising don't go for that. Yes. Try to treat. Especially in Instagram, they are different. We are confused to go for what, because one influencer is saying that and the other influencer
I
is
saw
saying
something in Instagram that they said wash your hair with the powder for machine.
washing machine.
Yes.
Okay. I happen to see one like you can color your hair applying Vaseline. Upon that, you put this Eno. There's a drink called Eno. You add both and then you color your hair. That is a total damage to your hair.
Yes.
So
And people do this.
people do this
Yes.
because they are so desperate about hair
Yeah.
fall. So the symbol of our beauty, let's try to preserve it. Let's try to protect it, but protect it right. With that, it's we signing off. Dr. Azin with Alka Meera Sunny at Micro Health Talks. Thank you.